So, what are the do's and don'ts in high risk pregnancy? So, this is a very important topic because it is extremely crucial to understand as to what is the right and what is the wrong to tackle with the high risk pregnancy, as it involves two lives, that is, one is the mother and the other is the baby. So, as I told in my previous video, that there are certain conditions which can be pre existing, like diabetes, blood pressure, and thyroid disorders, or even when the patient is above the age of 35, or obesity, which can be detected even prior to the pregnancy and can be tackled. So, like for example, if your age is increasing, better to plan pregnancy always before the age of 35. If at all, if there is a issue with overweight, then it is better to lose some weight and then plan pregnancy. If you have increased blood pressure, increased levels of your sugars, or increased thyroid levels, then it is always extremely important to control it before you plan for pregnancy. So, some things which we commonly see is one is anemia, that is low hemoglobin levels, which can be like detected early on. If at all, if you have symptoms of feeling weak, fatigue, hair fall, low backache, and not interested in anything, low on energy level all the time. So, in such cases, it is always better to build up the hemoglobin and then get pregnant. So, other things that can usually crop up is like, finding difficulty in losing weight, which has to be like, followed with a lot of like discipline, the exercise and the lifestyle changes, which can help in coming to a normal BMI weight and then planning for the pregnancy, which will reduce the complications during pregnancy. If at all, if you are going for an IVF, always like, try and have a singleton pregnancy, that is by asking for single embryo transfer, which will reduce the complications if at all, if you end up in twins or a triplet pregnancy. So, the other aspects which happen, that is during pregnancy, could be don't put on too much weight, don't eat for two, and don't eat a lot of junk, don't indulge in too much of alcohol, smoking, which can result in problems in the baby's growth, and also it can result in like you having a lot of issues with your weight. If at all, once you are pregnant, if you already have a pre-existing condition and in pregnancy, you need to take care of like the weight gain, you need to take care of your diet so that your diabetes and blood pressure is under control. You need to take care of your medications which you are on, to be taken regularly without missing. Like if, for example, if the doctor has advised you to be on a blood pressure medication, then it is prudent to take it religiously without missing even a single pill, rather than putting yourself at risk by missing on multiple pills. Also, at the same time, what you don't have to do or shouldn't be doing is, one, you shouldn't be like second guessing your obstetrician and try to like, take multiple opinions and finally get confused and not do any of the suggestions which has been told, like having enough water for yourself, like 3 to 4 liters of water is extremely important, having 2 vegetables, 1 fruit per day is important, having the right amount of physical activity and also right amount of sleep is extremely crucial, which we find it difficult in workers like software professionals or BPO employees, or like people who have desk jobs. So in these situations, you need to modify your day-to-day life so that you can accommodate enough sleep, you can accommodate the exercise and the right kind of diet. So above all this comes the obstetrician's role. So try and like, be compliant with your visits, that is have regular antenatal visits to your obstetrician, try and discuss your problems, and also try and like, update your issues to your obstetrician. And whenever you have been told to do a few tests, I mean, it is better to follow it diligently and do it. And whatever medications have been prescribed, say like iron medication, which will be increased based on your hemoglobin. So it may be difficult for some people to take it on a regular basis, but you have to stick to it so that you don't become anemic during your delivery. And also, not last or not to bring down the importance, the mode of delivery should always be in consultation with your obstetrician. So whatever your obstetrician decides on, whether it is to be an elective cesarean or whether there is an option for normal delivery. All these should be spoken along with your partner openly about your problems and also about your anxieties, and it should be a collective decision. So these are the do's and don'ts, and if you have any queries regarding the same, you can post it on the comment box. I'll be happy to address them. Thank you.